In this video, I'm going to talk about leadership and mental health, and I want to start off by saying that every therapist is a leader. We each guide our patients through difficult situations and strive to model adaptive behaviors, thinking styles, and foster emotional processing, which are all necessary for our patients living fulfilling and happy lives. Leadership and mental health starts with knowing your why. What goal you're working towards. What vision do you have for yourself, for your work, for the organization you work for? Think of this as the thing that gets you out of bed in the morning and feeling passionate for your job or your place of work. This goal will always be your guide. It's what you refer back to when you feel you and your team have strayed, and the thing that keeps your passion for growth and change strong. When we think about the purpose of a leader, it's to guide. With that in mind, we need to also understand that the leader is actually not the most important person on a team. Without the team, there's no need for a leader. Leaders need to show very clearly how valuable their team is to them, through word and through action. Why is this important? Well, every team and leader will confront failures and setbacks. It's inevitable. It's part of the job. Mistakes can provide the greatest lessons and the biggest opportunities for growth if we're open to them. And as leaders, it's essential to admit and fully own our mistakes, even if they aren't directly caused by us. By taking full ownership for a setback or a mistake, we remove things like pride and willfulness, which drive teams apart and make leaders feel distant. Leaders want to own the issues that come up, and they want to do that aggressively. Take ownership. Well, this needs to be extreme because to do otherwise allows for finger pointing and for the rifts to threaten the integrity of the team. By modeling and taking ownership, we let others do the same. And this opens the door for effective communication and adaptive change to occur. When things don't go the way we expect, we need to introspect, asking questions like, what did I do as a leader that gave rise to this consequence? Then we need to assess the use of each resource in the plan, the communication that we provided, and anything else that was related to it, and remedy as appropriate. The leader needs to take ownership over every aspect of a plan or a vision, including when others don't follow the plan. Then you might ask why. Well, because it becomes about relationship building, building trust, communication, things that are necessary for a team to succeed. Strong relationship with the team or with patients is a must. The trust that comes from a strong team or therapist-patient dyad opens the door for questions about the goal and the plan to achieve it. Why are we heading towards this? To build more understanding of the strategies that are in play and why. All of my team members know that if you call me out, I will seek to understand, not to prove that you are wrong or to make you understand what my perspective is. If someone doesn't understand a directive or a suggestion, then it means I didn't communicate it in a way that made sense for the person. And I didn't create an atmosphere that enables them or other team members or patients to seek clarification. As leaders, we need to understand what our patients and teams understand. Otherwise, plans are not going to be executed properly. Part of this includes how important it is for team members to believe in the strategy. Why will I work towards this with you? If they don't, then it's not going to work. Team members need to be invested and understand the plan and understand how it will benefit them and the others around them. This is the same for treatment. Oftentimes I find after explaining the details of an intervention, how it works, what the goal is of using it, a patient may say something like, I never knew why this would be helpful, so I never did it. I never followed through with my homework. The same applies to working with my team. I try to give clear explanations of why I believe something will fit and gauge for understanding so that I can get appropriate feedback and make sure that my team and I are working towards the same goal. It's more important that folks understand the why behind a goal than anything else. When I foster an open environment, I enable my team or patients to communicate with me and with each other in ways that increase their effectiveness. All teams must support one another and work together, even if under different leadership or at different sites. When problems arise, the last thing you want to do is blame. Instead, assess what each group or person can do in support of the goal and then execute with a shared plan. When working with multiple teams or multiple clinics, or in a situation where a patient has multiple therapists, family therapists, psychiatry, or case management involved, we need to identify common goals, roles, and understanding a set timeline, and to not jump too far too fast without understanding the risk of failure and the likelihood of it, in addition to the infrastructure required to fully execute a plan. Simple plans are way more effective than complex ones. For example, simple treatment plans are easier for patients to understand and for us to execute than complex ones. Fewer variables equals fewer opportunities for error. Simple treatment plans, simple plans in general with clear goal trajectories are going to be more effective. When plans or orders are overly complex, people may not understand them. And when things go wrong, complexity compounds the issues, and that can spiral out of control. Think in terms of DBT, active passivity and apparent competence. If something is complex and I'm presenting it in a way that implies you should understand this or this is obvious, I'm unlikely to get the follow-up questions that I need to make sure that I know what my team knows, and then to help them to execute the plans effectively. Simple, clear, and concise. That's how we want to make our plans. Each person must understand their role in a plan, and if the team doesn't get it, then as a leader, you failed. It's critical that the team or your patient be able to ask questions openly that seek to clarify what the plan is, the nuances of the plan, the goal of the plan, the why. This is great for higher level leaders, but what about for supervisors or staff clinicians, fellows, interns? Well, everybody in a team can be a leader. Leading up the chain of command is just as important as upper level management directing the rest of us. Upper level leaders won't know there's a problem unless they're told. And this can feel intimidating at times. Patients feel the exact same thing. How often does your patient tell you that you're wrong or that you haven't gotten something right if we haven't created an atmosphere that fosters that? It becomes easier to build a culture of leading up the chain if a leader models vulnerability, openness for change, and actively seeks feedback from others and incorporates it or accepts it without challenge. Only then will it become easier to lead up the chain and facilitate open and adaptive communication. As I said, this is true for therapy also. By treating patients as collaborators, they are empowered to be more proactive in their therapy and make informed decisions. This helps therapists better understand the patient's situation, variables that are in play, things that work and don't work, and to effectively problem solve for the situations that patients are facing.